Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what I bring to you all from the world of medicine. Heart failure patients unvaccinated against COVID-19 are 3 times more likely to die from it than boosted heart failure patients. According to a new research published in the Journal of Cardiac Failure, heart failure patients who are unvaccinated against the SARS-CoV-2 virus are 3 times more likely to die if infected with the virus compared to those who are fully boosted heart failure patients. This is the first to look at COVID-19 vaccination status and outcomes in patients with this cardiovascular condition and shows how dramatic the protective effects are in this high-risk patient population. The research is important since many heart failure patients are still hesitant to get the vaccination done due to the fear of developing myocarditis or inflammation of the heart muscle. This condition is a rare side effect of the Pfizer, BioNTech and Moderna vaccines, but a more common complication of the COVID-19 infection. The results of this work can help heart failure patients better understand the benefits of being fully vaccinated and boosted against COVID-19 and the protection that it offers. The researchers conducted a retrospective study to analyze the impact of COVID-19 vaccination status in heart failure patient population. They looked at around the records of 7,000 patients with a heart failure diagnosis. Of that group, 31% were fully vaccinated with both the doses, 14.8% were fully vaccinated and also had received one booster shot, and 9.1% were partially vaccinated with only one dose, and 45% were totally unvaccinated. The researchers compared the survival rates and numbers of admissions to the hospital and intensive care units between the groups, looking at both the all-cause mortality and the morbidity. It was found that unvaccinated and partially vaccinated patients were 3 times more likely to die from COVID-19 related illness than fully vaccinated and boosted patients. The study even goes on to explain how unvaccinated and partially vaccinated patients, they showed a 15% they were likely to be hospitalized if infected with the virus and nearly twice as likely to be admitted to the ICU when compared to those fully vaccinated and boosted patients. Hence the message here given out is, please go and get vaccinated, including getting the booster dose done. Multiple heart-related conditions to triple dementia risk regardless of their genetics. According to a large-scale new study, having multiple conditions that affect the heart are linked to a greater risk of developing dementia than having a high genetic risk. The study is among the largest ever to examine the link between several heart-related conditions and even dementia, and one of the few to look at the complex issue of multiple health conditions. Published in the Lancet Health Longevity, the study looked at data from more than 2 lakh people aged 60 and above. The team identified those who had been diagnosed with the cardiometabolic conditions, diabetes, stroke, or a heart attack, or a combination of the 3, and those who went on to develop dementia later in their life. Within the study population, the researchers found that more of these 3 conditions a person had, the higher was their risk of developing dementia. People who had all the 3 conditions were 3 times more likely to develop the condition than people who had a higher genetic risk. The participants were divided into 3 categories of genetic risk from high to low based on a comprehensive risk score reflecting multiple genetic risk traits. A widespread damage across the brain for those with more than one cardiometabolic condition was found. Therefore, it was concluded that by contrast, high genetic risk was linked to deterioration but only in specific parts of the brain. Intake of dairy milk and a greater risk of developing prostate cancer. Men with higher intakes of dairy foods, especially milk, face a significantly higher risk of prostate cancer compared to men with lower intakes. This is in accordance to a new study that was conducted by researchers at the Loma Linda University of Health. The study found no associations between increased prostate cancer risk and the intake of non-dairy calcium, suggesting substances other than calcium do play a role in the risk dairy foods possess for prostate cancer. The study evaluated the dietary intakes of over 28,000 men with a wide range of dairy and calcium exposure, all of whom were initially free of cancer. The dietary intakes were estimated from food frequency questionnaires and repeated 24-hour recalls. A baseline questionnaire, it included various parameters like demographics, the family history of prostate cancer, physical activity, alcohol consumption, prostate cancer screening frequency, as well as their BMI. The study's results revealed that men who consumed about 430 grams of dairy per day, that is approximately 1 3/4 cup of milk per day, faced a 25% increased risk of prostate cancer compared to men who consumed only half a cup of dairy milk per day. Also, men who consumed about 430 grams of dairy per day faced an even greater increase in the risk when compared to men who did not take any milk in their dairy. It was hence advised that prudent men with a family history of prostate cancer or other risk factors should be cautious about consuming even moderate levels of dairy milk as part of their diet. How pregnant women produce super antibodies to protect their newborns. Scientists discovered years ago that newborn infants depend upon the immune components transferred from their mothers to survive the onslaught of pathogens that being invading their bodies as soon as they are born. Now, eventually, children develop their own immune systems built through surviving natural exposures to viruses and bacteria and augmented by a phalanx of well-established childhood vaccines. But in the meantime, it's one of the mother's most important gift that keeps their babies safe, that is antibodies. Now, a far-reaching study published in the Nature journal provides a surprising explanation of how those early days of mother-provided immunity actually work and what that information could mean for preventing death and disability from a wide range of infectious diseases. The findings suggested that researchers may be able to mimic the amped-up antibodies that expecting mothers produce to create new drugs to treat diseases as well as improved vaccines to prevent them. Now let's look at how the mothers make these super antibodies. The new study identifies which specific sugar is changed during pregnancy as well as how and when the change occurs. Now, during pregnancy, the acetylated form of sialic acid, which is one of the sugars attached to the antibodies, that shifts to the deacetylated form. This very subtle molecular change allows the immunoglobulin G, which is the body's most common type of antibody, to take on an expanded protective role by stimulating the immunity through the receptors that respond specifically to the deacetylated sugars. Now, we've known for years that many far-reaching benefits of breastfeeding also. One major factor is the transfer of antibodies in the breast milk. The study shows that the molecular switch persists in nursing mothers so that the antibodies with enhanced protective scope are also transferred to the babies through this breast milk. Therefore, it was concluded that the immunity needs to exist within the mother for it to be transferred to her child. Without natural exposures or immunity primed by vaccination, when that light switch flips during pregnancy, there's no electricity behind it. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.